Thank you. Hello. Thank you. Hello, everybody. Welcome to today's conference. And we are going to get started here. Today we want to talk about the spine surgery coding. And there are a lot of different scenarios and idiosyncrasies when it comes to spine surgery coding that's different from what you may be doing if you're coding for either a neurosurgeon or an orthopedic surgeon, and what we actually how we actually do that. So what we want to talk about is we look at slide number 2 and talk about the agenda for today. First, we want to talk a little bit about the anatomy of the spine, because that's critical in choosing the appropriate codes. Then I want to give you some coding tips on what I use. Then we want to talk about the actual surgical procedures themselves, and I've kind of listed out there under surgical procedures the different points that we're going to talk about today. I'm not going to read through them here because we will discuss them. And then the last but not least, we're going to talk a little bit about some of the modifiers that we may be using that are different in spine than what we would be using in other cases. Just so you know, as it was read in the introduction, that I do work for a billing service in the Chicago area. The only specialty we do is orthopedics, and so I do all of this every day, so to speak. But not only do I have that position, but I also do work part-time for a orthopedic spine surgeon, and I do all of the daily and surgical coding for him. He's a single practitioner, and so I'm basically doing this every day and every night. So I have got a lot of experience in it, so I'm doing the same thing that you're doing. So okay, let's go ahead and get started then on the actual anatomy. So when we're looking at the spine anatomy on slide number 3, there are basically, some would say there are 3 portions of the spine, some would say there are 4, and then even some would say there are 5, depending on who you talk to. So here the different sections are listed. There are 7 cervical vertebrae, 12 thoracic,